So welcome everybody to the North East London LMS webinar on pregnancy, fertility and COVID-19 vaccination. You are all very welcome. We have a great panel lineup for you in this next hour, and we are absolutely going to want this to be an interactive session as much as we can. This is not about our panel talking to a lot of slides where you are just sitting and having to listen. We absolutely do want this to be interactive, and we have time for you to be able to pose your questions either in the chat box or to put your hand up and actually pose your questions to the panel. We do have a few slides, just some sort of short briefings for those that are on our panel today, but we really do want to use this session to be able to answer all your queries and questions in relation to the COVID-19 vaccination for all of those people who may be thinking about being pregnant, those that are pregnant, those that are breastfeeding and have their baby and maybe in the postnatal period and breastfeeding. So it really is time for us to be able to sort of give you some advice and support, our knowledge and understanding, so that you can go away at the end of this webinar and feel more reassured in this COVID world around vaccination and whether you may not wish to have it. So I really do welcome you. I would like to just do a little bit of housekeeping, and I think Safa has already noted some of that. Thank you. We do need to make sure that everybody's mic is off. We are expecting, it can be up to several hundred people that are dialing into this webinar. So please do keep your cameras off if you are not speaking, and please do keep your mic on muted if you are not either posing a question or speaking yourself. It will make our webinar go much more smoothly. So thank you very much. And as noted, we will have opportunity at the end of the first few slides for as many questions as we can pack in to this hour of this webinar. So without any further ado, I'm going to introduce myself first. I am Ali Heron. I am a midwife and a nurse and working in North East London, and also the Senior Responsible Officer for the North East London local maternity system, so therefore responsible for all of maternity services across the North East London. I have three other great panel members today. I have Mr. Rayhan Khan, who we can see there on screen, who is a consultant obstetrician in North East London at the Royal London Hospital, but also across the whole of North East London in a maternity medicine network, and also is the chair of the North East London LMS board. I have Dr. Jagan John, who is a local GP and as well as chair of the North East London CCG. And we also have, very pleased to have Dr. Kate Wiles, who is an obstetric physician, also leads the maternal medicine network across North East London, and is also a consultant nephrologist. That's quite a few words for me to get out and get them right. So I really wish to welcome them to this webinar, and really pleased to have them on board this evening. So without any further ado, because I don't want to take up too much time because we want to get to your questions, I will ask Rayhan if you would like to say a few words, Rayhan.
Thank you, Ali. Good evening. I hope that you can hear me all right. Actually, I think as nobody wants to see a photo of me, let's go to the next slide and just start thinking together. So I've worked in East London, trying my best to help pregnant women for a long time. It's the privilege of my life. One of the things that I want to say at the beginning is my respect for women in East London and their families in pregnancy. It knows no bounds. It's not actually easy always to live life in East London. It can be tough for a lot of the women and families that we look after. It can be tough to access health services. It can be tough if you don't speak the language. It can be tough if you get mixed messages from the media. It can be tough if you get mixed messages from your own family. And it can be tough because it's just tough. It's been really difficult time from a socioeconomic point of view. A lot of people have had to go without. A lot of people have lost their jobs. So I just want to set the scene, because actually when you then have a conversation which is genuinely for a lot of people very, very stressful, there is a lot of context of stress already. Now, for some of you, including me, some of that stress involves having lost your own relatives. So I will, again, with respect to that, pause for a moment to just reflect on the loss that we've already experienced since this pandemic started. I guess me and my panelists are here to share with you our thoughts about why people feel worried about having the COVID-19 vaccine in pregnancy, why we think actually it might be the single biggest gift that a mother can give to her baby, or that a family can give to a pregnant mother if she asks for their advice, or that a GP or a midwife or an obstetrician can give to their patient to recommend that they have this vaccine in pregnancy. It really does matter that much. There's lots of facts, if you like, on this slide. I'll talk about them. I'll talk about them in a second. But I'll tell you what my experience has been. So Ali gave me a very kind introduction, and you'd be thinking, who's this idiot who is chair of this and head of that? Actually, none of that matters. What my actual job is I look after pregnant patients who've got medical problems in pregnancy. That's actually what I do from day to day. And I love my job. And there are bits of my job which I really love, and there are bits of my job where it breaks my heart that I can't do my job better. And the thing which I wish I could do better would be explaining better the importance of having this vaccine while you're pregnant. So I'll break it into bits, not for your benefit, but for mine. I'm not the sharpest tool in the box. I've never been the cleverest person, but I hope I'm good at communicating what I'm about to communicate. And by breaking it into bits and telling you our story in East London, it might help. When this pandemic started, I was terribly worried for pregnant women. They were very low on the agenda. One of the things that worried me is that they would not come to hospital to get the care that they needed. We sadly saw some examples of that. I must say they were brilliant in terms of, like everybody, can we call it pandemic behavior, distancing, wearing masks? But of course, people were very, very worried about catching the infection. I would like to suggest that people aren't quite as worried about catching the infection as they were a year ago. I remember a year ago, I work in a hospital, everyone was terrified that we'd all die if we caught the infection. People don't necessarily think about it in that way. Then the vaccine came, and we heard that this is great and this is really going to help society to open up again. And these slides have moved back. And I think that, just move the slide forward again, please. And I think that, thanks. I think this is great, but when we think about where things are for pregnant women, how did pregnant women feel when the vaccine story started for them? Well, actually, if you go back to the very first communications, there was some caution, but you might be surprised to know if there is an answer to, is it safe to have the COVID-19 vaccination during pregnancy? There are different bits to it. One of them is that actually this vaccine has been offered to pregnant women almost since the beginning, almost since it came out. And a lot of people are under the impression that it's only recently become a conversation for pregnant women, but it was there at the start. And I remember I was looking after women who were pregnant with really complex medical problems, who, if they weren't pregnant, would definitely need the vaccine and needed it early on. And they got offered the vaccine and they had it. And they did well. So since then, we've learned a lot. So we might ask ourselves, and a lot of pregnant women ask me, what do you mean you've learned a lot? Has anyone pregnant even had this vaccine? So I might ask them, well, supposing I were to tell you that 10,000 women had had it without a problem. And they would say, well, okay, that's fair enough, but I'm still not sure. And I might say, well, supposing I told you 50,000 women had had it without a problem. And they might say, well, actually, I feel a lot more confident now. That happened to me today, actually. So in fact, more than 120,000 women have had this vaccine without problems. And that is a large number. So there's a lot of conversations that quite rightly women want to have around whether the research has been done. But actually, the research is part of the vaccine program, and those numbers are pretty compelling. So if you were to ask, what have we learned from giving this vaccine to a lot of pregnant women? What we've learned is that it's safe. So the vaccine is safe. But now I want to talk about what the other side of the coin is. It's all right for me to say that it's safe, all right? That's one thing. It is a different thing for a woman who is pregnant to think, is this vaccine safe? But I want to turn that argument around completely, because there are things that I see and I know that not all of you can see and know, because I see the other side. So one of the things that my colleagues and I do, midwives and doctors, is we look after pregnant women with COVID in hospital. Now you might think, firstly, you might ask, do they exist? So they definitely exist. And it's a very reasonable question if you ask, do they exist? Because we are told that when people are younger, they tend not to get a severe illness. But there are exceptions to that rule. And one of the exceptions is the last half of pregnancy, especially the last 1/3. So we have a lot of evidence that in the last 1/3 of pregnancy, people are definitely more likely to become severely unwell if they contract COVID-19. And sadly, I see that evidence daily at the moment, because we look after pregnant women who are very unwell, critically ill, in fact. These women did not necessarily fall pregnant with health problems, although sometimes they do. But they certainly have one thing in common insofar as none of them have had the vaccine. Now, you might ask, have they been offered the vaccine? So actually where we are is every adult is currently eligible for the vaccine. So either there has been an explicit offer or there is an implicit offer via vaccine centres, and you'll hear more about that in a very, very short while. Now, we don't fully understand why this infection can be so severe in pregnant women in the latter part of their pregnancy. But the effects of that severity, and I do need to emphasize this, are not just on the mum. There is increasing evidence that the effects of the infection itself on the baby are very, very important. We suspect that there is a direct effect on the placenta. We have seen evidence of premature labor, and we are starting to see evidence, albeit in relatively small numbers, of the potential for worse outcomes for babies. So this is not just a story about mums, it is also a story about babies. Now, I want to bring that forward because any parent, I'm a parent of 3, any parent spends a lot of their day worrying about their children, and perhaps less so about themselves. In antenatal clinics, the mums of East London who we look after always want to put their baby first. Now, thinking about this narrative is important because actually the most important thing for the health of a baby is the health of the mother. Plus, there may be evidence that there are direct health consequences of this infection on the health of mums. And superimposed on that, we are in East London. So I, like perhaps many of the audience, I have my own risk factors for a more severe COVID infection, and some of you will as well, such as being from an ethnic minority. And I think it's important to highlight that we in East London, we are special and we are vulnerable at the same time. We have vulnerabilities, and we saw that in the first wave and in the second wave. We had really devastating problems with a lot of people getting infected, and society is now opening up again. So I'm worried, I'll be honest with you, and I wanted to do something about my worry. And I thought the best thing I could do was to try and communicate the advantages of being vaccinated. And I just feel that this is a webinar, but I'm not going to stop doing that. I'm going to be doing that individually with the women who I look after, and I'm going to keep talking about that with everybody who I know, because I am sure that this will save mothers and babies' lives. So I'm going to leave you for now. We might have a chance to chat during the Q&A, and we'll move to the next speaker.
Thank you, Rayhan. That's extremely helpful, very emotive, and I think very from your heart and personal, rather than necessarily also just coming from that doctor perspective. So I'm sure that will be very helpful for everybody on this webinar to be hearing it from that side of things as well. So thank you very much. I think we would like to move to Dr. Jagan John, please, if possible, if you can move the slides on for Safa. And I'd like to welcome Dr. Jagan John to the forum.
Hi everyone, and thank you for inviting me for this webinar. I'm a jobbing GP in Barking, and I am the North East London chair. But what that means for all of you is that I am responsible or oversee the whole of the kind of vaccination campaign for North East London. And this is really important for us to kind of ask and hear comments from people, and also hearing comments that we hear in the vaccination centre. So what I'm here to tell you is the availability and some of the practicalities of you know, the vaccination, in terms of some of the questions I get asked at those vaccination centres. And you've heard some of the really compelling evidence from Rehan and his concern as a frontline clinician, and we're going to hear from some of our other clinicians, you know, about some of the concerns that we have. But if we move into the next slide, so in North East London, if you do decide you'd like to have a vaccine, there are huge plethora of vaccine centres. So we have big vaccination centres like Westfield, or for example, in you know, as you go further down, some of the other big centres, Excel and other places. Or we've got some GP practices, we've got some pharmacies doing it. What it is really about is to make sure that you feel comfortable. And if you don't want to be in an area that it's got a lot of people because you've got concerns, there are other centres, and you can access all of these things through either the national booking line, it's through the text, or there's a website address there which we're happy to share later on, and it gives you the options. But these vaccination centres aren't just about just having the vaccine. It's also there are clinical people there. So if you just want to fancy a chat and you would like to see someone face to face, just to talk to you or your partner, or anyone that's worried about the vaccine while you're pregnant or about to be pregnant, you can have a chat. You know, come and see us. We'll have there is nothing to tell you must have vaccine. Of course, as doctors, and I'm someone who's vaccinated myself, my wife is vaccinated, my parents are vaccinated, and I always say to my patients, I said, look, I'll be honest with you, if I don't vaccinate myself or my loved ones, then I wouldn't recommend it to anyone else. And I think some of the things we also hear is about the practicalities of vaccination, and this is something about, well, I'm on my own during the day because my partner's working all through the day, you know, and, you know, if you tell us how we can help in terms of, or I have to come with my other child, is it okay to come there at the vaccination? You can, of course you can, and we'll try to make it. And some of the mums came to me and said, look, you know, what do I do? You know, I just want to be sure. What will I get unwell? Because I can't afford to be unwell if I get the vaccine, and things like this. Well, majority of people, particularly the vaccines that are licensed for pregnancy, the Pfizer and the second dose AstraZeneca, we've seen very little side effects. Of course, there's always that risk of side effects, but invariably, majority don't. But of course, because you're mums and because you're worried, if there are anything, any concerns, we do have the vaccination centres are always available for a post-vaccination advice as well, or your GP surgeries, or through 111 in regard to any kind of side effects you might, or things that you might be worried about after the vaccination going forward. But from a very practical point, I have had patients who've been vaccinated, have had double vaccinations. They've gone to have their babies very happily. I've also had patients who have, trying to get pregnant and worried about the vaccination, and they've successfully got pregnant. And quite bizarrely, I've had a couple of patients asking if they could have the vaccination again to get pregnant again, but that's not what it's for. But see, but it has been a very positive experience from my patients, and I've got in my practice around 18,000 patients. But what you have here is a range of options for you, what's convenient for you. Most centres are doing pop-ups, i.e. or walk-in clinics, so you don't need an appointment. You can change your mind when you get there. You can come back another time if you. There is nothing to say that you can. You can be as flexible as possible so that you can make that decision. And certainly, as Rahana said, please think about the decisions, think about it. Obviously, we're seeing it from a side of obviously looking at the worst that we've seen within the hospitals, or the cases that things haven't gone well. And of course, for us, we're very keen to vaccinate. And some of the other things that, just to give you questions or answers, we won't be vaccinating before 8 weeks. We get a lot of people asking, saying, can I have it early because I'd like to go away. Most of, if not all, our vaccination centres will not be vaccinating for before 8 weeks, the second dose. And of course, for women, it will be Pfizer, because that's the one, or Moderna, which is the one that's been licensed as well. So yes, there are choices, but it is down, what's been recommended is the Pfizer and Moderna going forward. So yeah, so we're really here to help. Please use our sites for any questions, and of course, speak to us if you're not sure. I certainly have had lots of phone calls at the practice from my patients who are mums who just wanted to check through and get my view of the vaccine going forward. And I think most doctors, if not 99% or 100% of doctors, will say what they really think, and they'll say don't have it or do have it. And I haven't ever said don't have it, to be honest, unless I've really, really thought there was a concern because of some particular condition. But yes, I'm going to hand over to our next speaker. Thank you.
Thanks, Jagan. My name's Kate, and I'm another doctor working in East London, and I work with Rayhan in the hospital, caring for pregnant women and their babies. And over the last year, we have cared for a number of pregnant women who have come to the hospital with COVID. And it's my job just to summarise what's been said before we move on to questions. And I think in summary, what I'd like to say is that we are here. We're here to look after pregnant women. We're here to look after their babies, and we're open for business. So no matter what happens and what the prevalence of coronavirus is outside and the worries that are on the news, we're here, and we're here to look after you. So come to us, come and talk to us, come and let us know your worries. Come and ask us the questions that you have. And, I hope that we can share the knowledge that we've gained quite quickly over the last year to help you be confident in making a decision to protect you and your baby in pregnancy. Because pregnant women can have a COVID vaccine. And the reason they can have a COVID vaccine is because there are a lot of brave pregnant women out there. There were a lot of brave women who 6 months ago had less information than we have now, who opted to have the vaccine. And I'm very grateful to them because they've shown us that it is safe for them. It helps protect them in pregnancy, and also therefore helps protect their babies. And the reason I'm grateful to them for showing that is because we know that pregnancy is a risk. You're more likely to get severe disease at the end of pregnancy. I can't predict which of you might get sick and how sick you will get. But, if coronavirus exists in the community, some of you will get sick. But what I do know is the vaccine will reduce your risk. There's lots of information available on the internet, and the internet is is a scary place to be sometimes, and it's hard sometimes to get reliable information. But on the summary slide there, you can see at the very bottom, it mentions something called the RCOG. That's the Royal College of Obstetrics and Gynecology. There's a decision aid that looks at the advantages and the concerns that people have around vaccination, and that's quite a helpful document to access if you want some more information. In fact, you can find it if you just go into Google and search pregnancy COVID vaccine. There's a link through the NHS website or a link through the RCOG, and they're the second and the third links on that page. So that's really helpful, and that will reinforce hopefully what we're saying today. But there's just 4 of us on the panel today, doctors, nurses and midwives, but there's a whole lot of people out there to help and to reassure you and to help you with your decisions. So I look forward to being able to help you with any questions you've got today.
Thank you very much, Kate, and thank you, Jagan, and thank you, Rayhan. I think that has been, well, certainly even for me, just listening, I think it's certainly helpful, and I hope everybody else listening in has found it helpful about where you can get the information from. So I'm not sure that everybody potentially understands that the vaccination centres are there for you to as well drop in and get that advice and that support if needed. So that has been extremely helpful, and I'm sure everybody else as well listening in will note that if they're just wanting to pose a question or they're bypassing one of your centres and want to drop in and ask, I think that's really helpful because I'm not sure that that necessarily is what we might realise that the centres are there for. I think a lot of people think, well, I've got to book my appointment and it's only when I'm actually going for the vaccination. And then the same, as you will have heard, it's not just at the vaccination centres, it's your GP surgeries, it's with your midwives, it's when you're visiting the hospitals. Please ask the questions, never be afraid to ask your questions and never be afraid to ask any question. There is no question that we will find a silly question or one that shouldn't be asked. Even if we have answered that same question 50,000 times, for each individual, it's their question. So absolutely, I think that's one of the most important messages really coming out of here is about please don't be afraid to ask, don't sit in silence in your homes or out with your friends and your families, just not quite knowing and thinking, well, what if this and what is that, which is really why we wanted to put this webinar on and have it very much as that question and answer. Now I have said, which is nicely, we're going to move on to that question and answer session. I can't see the full chat box, but I have seen lots of questions coming in. And I believe, Safa, you are beavering away, looking at all of those questions that are coming in and are going to help to guide us into who needs to answer some of those and pose some of those questions so that everybody can hear the answers.
Absolutely, Ali. So you can temporarily put yourself on mute and take a back seat now. Thank you so much for chairing today's event. We are going to now take questions from the chat. Apologies if you can hear some pinging in the background. That's people still joining our wonderful webinar, which is great. We'll start with some questions that were received prior to the event for people who could not join. And I can see there are quite a lot of questions around AstraZeneca. So I will try to ask around the variations of this question once we've taken this first question. The first question is from a woman who says, I did not know I was pregnant and had the AstraZeneca vaccination, and I am now worried about the impact, for example, blood clotting. Can you advise? And that's a question directed to our obstetric colleagues on the call.
So I'll answer this one. So the first thing to say is please don't worry. The reason that we are offering Pfizer and Moderna in pregnancy is just because in America is where lots of our numbers come from. So more pregnant women across the world have been vaccinated with Pfizer and Moderna. It's because we have more data on those that we're offering it, not because we're worried about AstraZeneca per se. So if you've had AstraZeneca in pregnancy, that is not a problem. You are still protecting yourself and you are still protecting your baby. the issue then is, if you didn't know you were pregnant when you had the first one, is what you do for your second one. So we're not worried about AstraZeneca in pregnancy, and at the moment we're not mixing the vaccines. So if you've had your first AstraZeneca in pregnancy, then we would also recommend the second one in pregnancy to give you that extra protection. And if you have not had side effects from the first one, we don't anticipate problems with your second one either. So we would recommend it. And I've said that to my patients, and I have had pregnant patients who've had 2 doses of AstraZeneca in pregnancy without any problems.
Thank you, Kate. And I think you have partly answered the first question in the chat as well, that was linked to AstraZeneca, which is around somebody who has had their first AstraZeneca vaccine, has had a complicated pregnancy so far, and is nervous about having their second AstraZeneca jab due to lack of research. She's saying, I would happily have had Pfizer. Can I mix? Any advice? I can see you've partly answered that, but if you want to just clarify for this question.
Yeah, so as things stand, I can't offer you a mix. I suppose the very rare side effect with AstraZeneca is to do with blood clots. Pregnancy is not a risk factor for that to happen. So just because you're pregnant doesn't make it more likely to happen. I would recommend that you are protected as much as you can be from coronavirus. So that would be to complete your vaccination course. And I would urge you, please don't worry, and please complete the course.
Thank you, Kate. I just want to say, open to other colleagues as well who want to join Kate in these questions, because they are very AstraZeneca heavy to start with. Second question or kind of area of advice is from Emily in the chat, who has put, I had AstraZeneca COVID vaccine in March 2021. I then fell pregnant in May 2021 through IVF. I was due to have my second jab in June, but I chose not to have AZ. As it's not been approved in pregnancy. I don't know what to do. I want to have the vaccine to protect myself, my family and my baby, but I am concerned it hasn't been approved for pregnancy, and this is somebody with a preeclampsia and high blood pressure in their first pregnancy with no side effects after the first AZ jab. What would you advise for them, Kate?
So again, it's not that the Pfizer and Moderna are safe in pregnancy and the AstraZeneca isn't. The Pfizer and Moderna we just have more information about, so it's that they're being recommended first. But I don't worry about AstraZeneca in pregnancy. And I think if you've had complications in a pregnancy before, I think what you don't want is to have COVID infection as well as any possible complications. So your best chance of a healthy pregnancy would be to have the second dose, because it offers more protection.
Thank you very much, Kate. The next question is, it's a question that's come from our social media channels on Facebook via our East London Maternity system page. Bit of a plug for our social media. There is varying advice on the safety of the vaccination during breastfeeding. My health visitor told me I categorically could not be breastfeeding if I had the vaccination. I have done my own research because I'm a healthcare worker. Who should I believe? JCVI guidance or my own research? On my own research or my health visitor who's providing some slightly different advice. If we could give that question to Jagan or Ali.
Actually, I'm going to give that to Rehan because he put his hand up. Sorry.
So thank you for the question, which this is a fantastic question, but I think it opens out 2 different things. So one of them is very short, actually. So the answer is the JCVI advice is the advice that me and my colleagues use. So they published advice on the 30th of December saying there's no known risk in giving COVID-19 vaccines to breastfeeding women, and therefore breastfeeding women from very early on were eligible. So that's, in a way, a very short answer to that part of the question. But the really interesting part of the question is that it's opened up something which we seldom talk about, which is healthcare professionals are people too. And they are confused and scared because this is still a relatively new illness, virus. And everybody feels worried. And that has an impact sometimes on our interactions with the women who we look after, because we have our own concerns. So I talked to you before about the conversations I try my best to have with the pregnant women who I look after, together with Kate and my colleagues. But they're not the only conversations what I have. I also have conversations with my colleagues who are midwives and doctors and other healthcare professionals, because they are people too, and they're worried too. So I've got a lot of midwifery colleagues who worry enough to not have had the vaccine, and I worry for them because they're working in a hospital. They're really exposed. So I really worry about that. What I want to emphasize is the advice that your health visitor has given. I promise you it was in good faith. I promise that. But if you were to ask me, is the advice that your health visitor has given based on national guidance, which in turn is based on evidence? I think the answer is no. So it's not just my job to just continue having conversations with pregnant women. It's actually my and our job to continue having conversations with everybody. I don't deny that there's confusion. I don't deny that the national advice could have been and should be more available and easier to access, and maybe better written and clearer, for which I didn't write any of it, but I apologize nonetheless. I am sorry on behalf of the establishment. But I think, therefore, there is a very straightforward answer to your question. And I think what the health visitor has advised is in good faith, but I think the answer is actually from JCVI. Thank you.
Thank you, Rehan. We'll move. I can see lots of questions coming into the chat, and I promise we will take as many as we can. And those that we can't, we will be posting the answers to those on the North East London CCG website and on our social media channels as well. So we'll swiftly move into the next question, which is from Lucy, who's put in the chat. What about long-term effects for the baby? I'm happy the vaccines are safe in pregnancy, but long-term effects in children are not known. Also, mRNA is a new vaccine in pregnancy. I work remotely and have 4 weeks left in pregnancy. Can I self-isolate? Rehan, is that yourself again?
Can do. Can I do the second one, and then maybe perhaps Kate or anybody can pick up the first one. So actually, that came up in clinic today, and I listened to Kate Wiles's answer when this question came up about mRNA vaccines. And actually, I thought she had a very interesting way to describe why it's incredibly unlikely to be a problem. Guys, you remember when the Pfizer came out? One of the things we learned about it is that you've got to be really, really careful in how you transport it. If you defrost it, you've only got so long to use it. It's actually inherently unstable in time. And so you've got to give it in a certain way. You've got to give it quite quickly. This is not untypical of mRNA vaccines. But actually, when you think about the physiology, the biology of what happens next, a vaccine of that nature, as soon as it hits the placenta, which is the interface between the baby and the mum, is actually not going to get to the baby. The chemical factory aspect of the placenta is exactly the kind of thing which is going to mean that we would estimate none of the vaccine itself will actually reach the baby. Now, the antibodies generated in mum will reach the baby, and that could be hugely advantageous for the baby because the baby would be born with some immunity. So I think that's the best answer I can give to the second bit. Kate, did you want to try the first bit?
Yes, I think the first bit was about long-term outcomes. Like we've said, this is a new disease and these are new treatments. And so we don't have long-term outcomes yet. But what I would say is that the reason we're so keen to protect our pregnant women and to give them this advice about the vaccine is because we know that in that latter half of pregnancy, having COVID is associated with risk. And one of those risks is that we need to deliver the babies early to keep the mums well, for the mums to be able to breathe. And what we do know is that if we have to deliver babies early because of COVID infection, that does have long-term implications. If your baby is born preterm or small, your baby is more likely to be sick and your baby may be slower at developing certain skills. So an early delivery is something we want to avoid. And if the COVID vaccine protects you from that, then that is something we would recommend to improve the long-term outcomes for your babies.
Thank you, Kate. And linked to that, there is another question around actually long-term effects. This is somebody who's asking long-term risks and effects for the person having the vaccination. Surely we can't know the effects of this just yet. Did you want to comment on that, Kate?
Yeah, so we can't know the long-term effects, but we will know the long-term effects. But like I say, we've started to learn some of the long-term effects of the infection. So again, related to early delivery, there would potentially be long-term effects on the baby. But we also, I think everyone's probably heard of long COVID, and the fact that some people who develop this infection, don't recover quickly and have, long-term health effects already, even within the first year of us knowing about this condition. So I think in terms of thinking long-term, I'm much more worried about infection than I am worried about vaccination and protection from infection.
Thank you very much, Kate. The next question we have already answered previously, and that was around research and AZ. So we will move on to our next question, which is it worth having the vaccine as I'm now in my 3rd trimester? Ali, did you want to take that one? And I realise we've been a bit unfair and not giving you any questions.
Right, there've been a lot of very well-directed questions to the right people who will absolutely give a way better answer. But yes, absolutely, you can have your vaccination in the 3rd trimester. There is really no issue in having it in the 3rd trimester. If you are making a decision to have it, we absolutely then will support you at any stage of your pregnancy to have your vaccine. So it is absolutely fine to have it in the 3rd trimester. You may be thinking, well, what if I have the 1st dose and then I have the baby and then I need my 2nd dose? You can still absolutely have it that way. It doesn't mean that you then won't get your 2nd vaccine because then you've had the baby. It's not that you've got to get both of your vaccines while you are pregnant, because obviously dependent on when your baby's coming. So yes, absolutely, it is fine for you to have your vaccination in your 3rd trimester.
I'm going to keep you on the platform, Ali, and we move on to the next question, which is linked to that. So in terms of trimester, because this is a question that we get quite regularly through our forum as well. And so this is a question around, apologies, is it more dangerous for the baby if I get my vaccine the 1st trimester as opposed to the 2nd trimester? I have actually taken Pfizer in week 12 and 16, and I'm now scared to have done a mistake in taking the 1st jab in week 12. Ali, maybe you want to start and bring in our colleagues Kate and Rehan as needed.
Thank you, Safa. And yes, I'm sure maybe Kate or Rehan might want to add into what I've got to say. But yeah, I'd really like to reassure you that please don't worry about your baby. No, there is nothing wrong in you having your vaccination at the stage of your pregnancy that you've had it. And it does not mean that you are going to cause any harm at all to your baby through the rest of the pregnancy. In fact, you may be thinking, or we may be thinking, that actually it's a bonus for you to have had your 1st vaccine, your vaccinations earlier in pregnancy, because then it actually, and particularly if you then had 2 doses before you get into the later stages of your pregnancy, then absolutely you are generating your immunity before the point then that your baby is being born too, and sort of really helps you through that later stage of your pregnancy. So please do not be worried. Do not be thinking that you have done anything at all that might harm your baby. It's absolutely you've done the right thing. And by all means, have your 2nd dose. I can't remember if it was said, Safa, that you'd had your 2nd dose or not. But if you are contemplating not having your 2nd dose, I would absolutely encourage you to go and have your 2nd dose. I don't know if Kate or Rehan wish to add anything or happy with my response to that one, or is there anything else that you might add? I've got some nods from them.
So I would just say that I think early pregnancy is a really kind of scary time, regardless of COVID infection. And I think, you know, everyone's always happy when we get to 12 weeks and you get that first scan and you can be reassured. So for some people to be really confident, they like to have that scan under their belt to be able to go and have the vaccine. But it's not essential. It doesn't cause any harm to have it done sooner. And like Rayhan said, this vaccine doesn't get across the placenta. The baby's protected from the vaccine, but the baby benefits from your immunity. But I can understand that some people just want to know that they've got a healthy, normal pregnancy in the right place before they want to go, so they can be confident making that decision, and that's fine.
Thank you both to Ali and Kate for taking that question. The next question that we're going to take is in regards to fertility. How can we know the effect of fertility for future generations? Would you recommend the vaccine for a 13 or 16-year-old? And if we could open that to the floor.
I can take that. In some of the countries, Europe, particularly in Europe and in America, they have started vaccinating 13 to 16-year-olds quite openly. They've done probably close to 1 million vaccines, if not more, in the US. So they're already vaccinating. So their data, they've got quite a lot of data in terms of the safety in children. There has been some discussion here about changing the JCVI guidance here. At this moment, we're not vaccinating, but there is definitely possibly a move to consider moving lower down into children from the age of 14 and above, I think. But at the moment, the guidance hasn't been put out, and certainly the evidence so far said that there hasn't been any untoward effects on children or young adults, certainly looking at world data so far on those countries. I also want to say that they're just one of the questions, just to comment on, other countries are mixing vaccines as well. Again, we're waiting for some more evidence, with whether, moving different vaccines and so on is beneficial or not. I think we quite rightly are monitoring it before we implement it. And I do get a lot of questions asking about mixing vaccines and also getting it in a younger age group. But currently the guidance is no. There will be a September, likely a booster vaccine across the system, across the whole of the country. And there is questions of whether they may consider mixing the vaccine at that point. But at this point, it's still currently keep to the same vaccine, and also keep to this above 16. It's only very particular age groups or particular illnesses where you can have a consultant like the two here, who can make a decision whether they think it's in the best interest of that young adult or and so on. But it is an exceptional case rather than anything else.
Thank you, Jagan. Just looking to the chat, I can see there's lots of questions in relation to things that we have already addressed. So we have had questions.
Safa, sorry, can I just, Rehan is short of doing a Mexican wave. Can we bring him in?
Sorry, I couldn't see you there, Rehan. Come in.
So you can't do a Mexican wave on Zoom, I believe. All that happens is you see my belt. So I won't do that. But I will, if it's all right, Safa, may I just say something about fertility? Fertility. This came up a long time ago. If you're starting to get used to some of my shorter answers, there is simply no effect on fertility. Now, you might argue, it'd be not unreasonably, how are you so sure? Dr. Khan, how are you so sure there's no effect? So the reason, not just me, but the British Fertility Society and the Association of Reproductive and Clinical Scientists are so sure is, firstly, it's biologically implausible that current vaccines could have any impact on fertility at all. Now, there was actually a non-science-based opinion piece many, many, many months ago, where someone postulated a problem that then spread on social media, and it has no backup. There is zero evidence for it. What subsequently happened is, when you think about it, there is a way to investigate fertility in a short time space, and that's to look at other species. So they've done fertility studies on rats because they reproduce very quickly. Neither Pfizer nor Moderna, as expected, had any effect on rat fertility. So there is no evidence that vaccinated women have gone on to have any fertility problems. And because that vaccination started really quite a long time ago now, if there was evidence, we would be starting to see it already. The theory that immunity to the spike protein might lead to fertility problems is not supported by evidence. Most people who get COVID-19 will get antibodies to the spike. There's no evidence of fertility problems in people who've already had COVID-19. So the British Fertility Society promise they will keep updating their advice as more information comes in. On the best information that I and we can find, there is simply no effect on fertility.
Thank you so much, Rehan. I'm going to keep you with the mic at that stage because the next question is connected. This is a question in the chat. There has been reported cases and ongoing studies into the vaccine's effect on women's menstrual cycles. I know people personally who've had their first period in years after the jab, or have had their periods delayed, menstrual cycles, or that they are much heavier afterwards. I'm worried that if it can do this, it can affect the womb and conditions for the baby in pregnancy.
So the reports are not currently backed by any robust evidence that this is a genuine vaccine side effect, and it's actually very difficult to interpret. I'll give you an example of why it can be difficult. So I have to do obstetrics and gynecology. So I do them the best I can. One of the things that I try to help women with in gynecology clinics is fertility problems, but another big one is bleeding problems and menstrual irregularity or irregular periods. And that can be a blight on women's lives. But actually, if I think about what the most common reasons are for problems like that, one of the most common is, in fact, kind of emotional state and stress. And another really common reason is we don't know. We don't fully understand it. So that's the background of menstrual irregularity. Now think about the webinar that we're having. There is, of course, an underlying stress in having this vaccine anyway amongst everybody. I would actually be very, very surprised if there wasn't some proportion of women who have unexpected menstrual symptoms following the vaccine, because of the experience of having the vaccine. Whether that makes it a vaccine side effect or not might depend on your point of view. I'm of the opinion that you could regard it as a vaccine side effect, but in the information that's been collated so far, we have not found any gynecological symptom, for example, menstrual symptoms, are robustly linked with this vaccine. We will continue to collect the data. Even if it was, I wouldn't perceive from that an effect on fertility or on future health. Now, I hope that helps, but I want to recognize that actually that was a very important question. And if you are experiencing menstrual symptoms, my advice would be to talk to your GP. Your GP would be able to take a history, would examine you and think about this from a holistic point of view, and could, if necessary, refer you to see one of the really good gynecologists in East London. Thanks.
Thank you, Rehan. And speaking of GP, we'll move to our resident GP in our Q&A panel next. So this question is around vaccination centres. Has the message about making women welcome actually been passed on to the vaccinators? I have seen on the news women being turned away because they have a child or two in tow. It is really unfriendly and wrong to make women with dependents feel bad and to deny them the vaccination if they've got no immediate childcare. How are we dealing with that in North East London? Dr. Jake and John.
Yes, well, I'd love to know which centre it was, so please let me know, because we've been very clear we should welcome everyone with their, everyone's life circumstances are always very different, and we have to be understanding. We've made it very, very clear. I think in the beginning, where there was real concerns about social distancing and fear, I think there was all sorts of misinterpretations from some of the vaccine centres about, oh, you know, we can't have too many people, all these kind of things. But that's all changed now. And certainly, you know, I can reassure you to say that we will definitely reiterate the fact that we won't be doing that. And certainly we would, because we do, I mean, it's something I do. I was vaccinating at the mosques recently for 2 to 3 days, and we had midwives, we had children with their, you know, with their mums coming in, and you know, they were there while we were vaccinating, and we're very happy to do that. But certainly it is the message across all our centres, and I certainly am very happy to pick up to see if there are any anomalies across the system, because for us, with my colleagues here, it is about us getting as many people vaccinated as possible, so that we can protect you and, of course, the welfare of your babies and your children.
Thank you very much. Really overwhelmed and pleased with the number of questions that are coming up in the chat. As I said, if we can't take them now, we definitely will post the answer onto our social media and on our websites. Really important that we can get these answered. I'm going to take a question which actually came through to us privately, and this is in regards to somebody who's having their injection every 3 months for testosterone. The question is, are they allowed to have the COVID vaccine, please? They need your advice. Rehan and Kate.
I'm not an expert in testosterone, but I would just say that as far as I'm aware, there isn't any medicine that people are taking or that are prescribed that would cause a problem with having the vaccine. The only caution is sometimes for people who are on high doses of blood thinners. They just need to be warned that there may be some bruising when we use the needle. But other than that, I am not aware of any medicine that would stop you having the vaccine if you choose to, and we would support anyone on any medicine to be able to access vaccination.
Thank you very much. I'm afraid we'll have to conclude the question and answer session at that stage, and I'm going to hand the mic back to Ali, who will talk us through how we can get these answers, any questions unanswered, answered, and how you can stay in touch.
Thank you, Safa, and thank you for the panel for answering all of those questions. It has been absolutely fascinating to see all of the questions popping into the chat box, and I know that we will no way have answered them all because there has been so many, but that is exactly what we wanted. We wanted this very much to be that question and answer session. So we absolutely will be taking, as Safa said, all of the questions that are posted in the chat box, all of those that Safa's are saying is also coming in sort of in a more private route. We will make sure that we do a Q&A.
Apologies, Ali. I just want to let you know that you're coming in and out on your mic, so I don't know whether you could come closer to your mic.
Okay, hold on. Let me just. Is that any better?
Perfect.
Me now. Yep. Sorry. So yes, just wanted to say I know that we will not have answered quite a number of questions because I've just been seeing lots and lots popping in. But absolutely, that is what we wanted this webinar to be about, is you absolutely posing all of your questions that you would like us to be answered. For those who might feel frustrated that we haven't got to your question, then we are very sorry we haven't got to your question, but we absolutely will look at all the questions that have come in through this webinar and privately, because Safa is saying that there are some coming through privately. We will make sure that as a panel, we respond to each of those questions. We will put them in a document and we will make sure that they are uploaded on our website so you have access to that. And I'm sure we will look as, for North East London, LMS and the North East London CCGs, we will look at probably putting on some more of these webinars going forwards if need be. I think it's been an extremely fruitful session. I certainly have enjoyed it from my part. I hope the panel have, and I hope all of you, and I thank you very much. I think we were approximately 100 people that I could see that had joined this webinar, and that's absolutely fantastic. Thank you very much for spending the time joining us this evening. Thank you very much to the panel, and have a good evening, and have a very happy and healthy pregnancy for those that are already pregnant, and for those that hopefully at some point in the future might be coming through our services in North East London. We'll very much look forward to welcoming you and meeting you at some point in the future. So thank you very much, and I wish you a good evening. Go and enjoy some of this sunshine while it lasts. Thank you.
Just a big thank you to all our panel members, and we'll touch base soon. Thank you.
Thank you. Well done.